that I've just described have secondary activities which support them basically. These secondary activities are firm infrastructure, technology, human resources, and procurement. Okay. Firm infrastructure looks at a wide range of support systems and departments such as finance, legal, strategic planning, most of which are best outsourced for a dental practice. Outsourcing has various ups, such as leaving the practice more time to attend to patients and other relevant activities, but it also has its downsides in that you might not have chosen the right people to outsource to. I'll take claims management, for example. It makes sense to outsource this function because you don't always want your staff having knowledge of the practice income. You yourself, if your practice is productive, shouldn't have time to be capturing and following up on claims. You shouldn't be consuming yourself chasing bad debts, basically. But what if the claims management company you chose claims incorrectly, exposing you to medical aid fraud? Is there dental claims association in existence in South Africa, for example? No, there isn't. Outsourcing to unregulated industries has high risk, but there is potential value to be gained still. It's just to say be careful around that. Technology can take the shape of utilizing new dental equipment designs and techniques to achieve a superior service. Making use of social networking to keep in touch with the patients also comes to mind. Some practices are now interacting with patients via BBM, for example. The utilization of the internet to order supplies or follow up on orders also shows the importance of utilizing updated technologies in your practice. One of the most important upcoming technologies is electronic storage space. The claims management backup that you perform onto a hard drive can be done directly into a secured site on the internet. In this age, practices shouldn't even be operating with physical files anymore. A paperless practice opens room to environmental friendliness, if that's your thing, cost savings, and high levels of efficiency. Value added. Human resources relates to your staff. This can include training, developing, recruiting, and so on. Some of the world's biggest corporations like to brag how they always recruited the best while they were coming up, never compromising on quality. Now, anyone in practice will tell you that they don't have time to be looking for the best necessarily. They need a convenient solution when it comes to employees. Hence, a lot of practitioners use their cousins or the neighbor's child as a receptionist. Taking extra care in the recruitment process can save you a lot of stress, basically. That's what I'm just trying to get at. Also, taking care to fully understand your recruitment needs is equally important. If your practice has 3 chairs, for example, it might be wiser to hire 2 dentists and 1 dental therapist or oral hygienist as opposed to 3 dentists. The salary difference speaks for itself, and furthermore, you can direct the specific types of treatments to the hygienist or the therapist. A lot can be said on training when it comes to HR, training and development of employees, because it's often neglected. Basics such as telephone etiquette, time management, and so on are not skills that everybody is born with. You need to teach your workforce these skills and build them into an efficient team. A dedicated workforce results in lower staff turnover, higher levels of productivity, and basically a positive vibe in the workplace. Patients can feel the vibe in a positive working environment, and it acts as a precursor to an environment that promotes customer satisfaction. Procurement links up with logistics and dealing with suppliers, as I mentioned earlier on. There's not too much I can add on here except to reiterate the concept of globalization. Now, Porter figured you can create value by improving anything within these sectors that I've just mentioned. The same value can be translated into a competitive advantage, which sets you apart from other practitioners in the eyes of patients, basically. Now, I personally want to start with cost here. I personally believe cost is the worst means of setting yourself apart from the competition. Offering your services at a cheaper price is a tactic that can easily be copied. Just bear in mind that it can also raise questions about the quality of your service. One justifiable reason for offering treatment at a lower price is if your cost of production is significantly lower than other practitioners. Now, this links up directly with the cost saving techniques I mentioned previously, such as group buying, buying from manufacturers, recruiting strategically, and so on. Another thing about price is that you can raise it and give people the artificial perception of prestige. Another poor tactic to utilize, because in this kind of market, as far as patients are concerned, scaling and polishing is scaling and polishing. Quality is another means of setting yourself apart from others. Excuse me. Quality is another means of setting yourself apart from others. Your technique, the use of the most efficient dental technologies, and the service environment quality can warrant you charging more than your competitors, basically. I ran into a patient who perceived that she receives a higher quality service because every time she goes to this one practice, they take an x-ray of her and then the practitioner proceeds to work. Whereas at another practice, no x-ray is taken, but the same kind of work is done. So in certain instances, it might be worthwhile to educate your patients about the quality in your service. Some practitioners, they hate walk-ins. Others welcome them with open arms. The flexibility of the practice schedule and the ability to book patients goes hand in hand with the rate of production and the number of human resources at your disposal. If there are 3 treating doctors at one practice, flexibility for walk-ins improve. Even if one treating doctor is tagged and can work diligently without compromising quality, patients can be accommodated into the schedule, basically. This ties in with what I mentioned earlier on regarding the kinds of patients you want to attract to your practice. If you'll take anybody and everybody who pays regardless of appointment, then this issue really doesn't matter to you then. But for some practitioners, as a matter of acceptable social behavior, one must book an appointment. So sometimes the difference is all in the customer's experience as well. This ties back to all the stuff I mentioned earlier on with regards to respect, humility, and professionalism. The subject matter that was mentioned regarding managing human resources with a view to improving efficiency and productivity, it's also relevant to the customer's experience. The service environment and various factors which affect the experience were also pointed out, and then the experience can of course also be enhanced by after-sales services. Now, convenience can also be tied to flexibility, but also stands on its own. The location of your practice, for instance, if you're based in a mall or in the CBD, you could have a high foot count, which you convert into patients. The accessibility favors practices located in such areas. Another example of having a good location is having your practice within the same rooms as other healthcare professionals. The convenience for the patient is a matter of practicality right there. Also, in hospitals, you find the practices which are located on the ground floor are the most popular just because of their convenient location. Another source of convenience is the availability of speed point machines, so that patients don't have to carry cash. Other practices offer debit orders and even dental plans. Just different ways of allowing them to pay, so that it's offering them a different form of convenience, short of actually putting an ATM inside your practice. I was shocked to find that even doing pre-auths on behalf of a patient is perceived as a convenient solution. Apparently, there are practices that don't do people's pre-auths on their behalf. So yeah, it's that kind of situation. Unique service features is open for interpretation. Once again, ask yourself, what does your practice do for patients that no other practice does?